Well, it's a genetic disorder. Most classically, it involves having an extra chromosome. So we call it trisomy 21, and it can affect developmental skills and intellectual ability, as well as different aspects of physical growth and development, and health in general. It's usually identified in the nursery by the pediatrician or other provider. It may be identified prenatally, typically from an abnormal AFP test that a mother would have. Now, an abnormal AFP does not mean necessarily that the child ends up having Down syndrome after they're born. However, it is one of the markers to make us look for that. When the baby is born, the provider will identify different physical characteristics that would lead them to suspect Down syndrome. So, for instance, they may have almond-shaped eyes. They may have a certain set to their eyes, kind of low tone, which would be being a little bit noodly and not really sort of as stiff as another baby might be. Having something called a simian crease on their palms instead of the two creases. They might have brush filled spots in their eyes, and they may have something called brachycephaly, where their head might be perhaps a little wider and flatter in back. And so after they notice certain symptoms or signs, they'll order genetic testing. And so then we look for whether the baby has 3 chromosomes or other similar type of anomalies that can lead to Down syndrome. And once the baby is born, there are health issues associated with Down syndrome. Many babies with Down syndrome will have cardiac defects, so that's really important to know, usually in the NICU. So, for instance, something called AV canal or a ventriculoseptal defect is pretty commonly found in children with Down syndrome. But they're also at risk for things such as thrombocytopenia, which would be low platelets, which are involved in clotting, and thyroid disorders. And they also may be at risk of something called atlantoaxial instability, which is your first and second vertebra. As soon as a baby can, we like to start in with therapy, whether it's early intervention, babies can't wait, or through private therapists such as our own here at the Autism and Developmental Center. They need to have physical therapy often, occupational therapy, as well as speech therapy, and that just can't be underestimated, the importance of how that improves how a kiddo does throughout the rest of their life, really.